Hello, good afternoon, and welcome to our first 1001 Days webinar. It's great to see so many familiar names joining and also some that aren't so familiar. So hopefully we're reaching out to new people through the process. Whilst people are still joining, I thought I would just introduce myself. So I'm Ben Curran. I'm the campaign manager at the Parent Infant Foundation, and through that role, organizer of the first 1001 Days movement. So our movement is an alliance of over 200 organizations and individual members campaigning to raise awareness and also to drive change for babies and their families. And we run these webinars really to give our members a platform to share their expertise and best practice. And so ultimately that we can learn together and get to know each other that little bit better. Today's webinar is a little bit different to the usual format. So rather than having one of our members talk about their work, a campaign, a piece of research, we're going to share some work that we've been doing as the steering group on behalf of the wider First 1001 Days movement to create a manifesto for babies that we can use collectively to influence ahead of the next general election, whenever that comes. So there's a few sort of distinct sections to this webinar. So after I finish the introduction, I will then talk to you a little bit about how we got started in our survey of members. I'll then hand over to Laura Anderson from the National Children's Bureau, who are one of the members of our steering group. And she'll talk about what we did with some of that information and how we use that to come up with some of the recommendations in the manifesto. And then she'll pass over to Tamora Langley, who will talk us through the headlines. So things like the key recommendations, a sneak peek of what the manifesto might look like, and some of the next steps to make sure that it's influential, not just a nice document that we've all spent a lot of time working on, but something that can help us shift the dial for babies through the general election and into the policy of the next government, whoever that may be. So I'm just going to start to share my screen so you can see some slides that we've put together. So first of all, I just wanted to talk a little bit about what we wanted to do through this process. So we wanted to create something useful on behalf of the movement. Again, making sure that we help to shift the dial for babies and their families through various policy levers by having a useful manifesto. We want to ensure that the manifesto reflects the broad nature of our movement being made up of big organizations, small organizations, some in the charity sector, some in the public sector, and of course, individual members who usually, for the most part, are professionals that work directly with babies in one way or another. And also we wanted to make sure that it was in touch with the current climate, so addressing sort of current issues that babies are facing and making sure that we have sort of what we think are the most up-to-date solutions rather than just relying on particular campaigns we might have ran previously. So we started that process by putting together a survey of our membership. And that was really designed to begin to gather views, different insights, different ideas, and also make sure that we knew what everyone was already doing and already asking for, so we could make sure that our manifesto reflected that when it came to being published. And so we framed that initial survey around our consensus statement. So that's something that every member signs up to when they join, whether they're an organization or an individual member, regardless of size of the organization or whether it's in the voluntary sector or public sector. Because we did that because we wanted to build on areas where we already had clear agreement and clear alignment, but also to help us do a bit of a sense check, make sure there's still priorities and have a bit of a discussion about the best way now in this climate in 2024 to be advocating for those things, because it might have changed since 2021 or 2020 as we've moved forward. So through that survey, we had 109 responses. That is from both individuals, their individual members, and our organizational members, whose responses would have been officially on behalf of the organization themselves. And within that, it hit the whole sort of mix of the organizations and individuals that are part of our membership. So there were the big and small charities. In the public sector, there were NHS trusts and councils. And from individual members, there were people who worked in early year settings, who were midwives, who were health visitors, social workers. So we're confident that the results of that are representative of the membership, which, like I say, is really important to us, that the end product is something that is genuinely reflective and something hopefully all members feel that they can endorse. The first question we asked as part of the survey was, is a cabinet level children's and family minister still a priority? So this is something that we have called for previously in the past. And so we just want to do a bit of a sense check. Is that still a right ask to make? So there is something at the moment. I mean, there is a minister for children, families and well-being, but it's a junior post, not at the cabinet level. And it was interesting to see that the vast majority of the membership still feel that is a priority, that it should be up at cabinet level. And, you know, the result sort of speaks for itself. It's the sort of result that Vladimir Putin might be expecting in the next Russian election. Very overwhelming. But within that, there was some discussion and some comment that was really helpful to provide a bit more detail and help us with our thinking. So some people commented that actually that we should call for the inclusion of babies within that, which interestingly is something that we're seeing more of in the public policy landscape. A lot of politicians are now talking about babies, children, and young people. So interesting that those chime together. And then one respondent put it quite nicely, and I'll sort of read the quote from the survey, which they said, "Inconsistency and gaps in cabinet level ownership have delayed or impeded development of this agenda over the last 10 years. Such a position would set goals and hold stakeholders accountable." So giving a bit of an explanation of why this sort of thing is important. It's not, because at the moment, like that response said, sometimes things fall, health say it's their issue, education say it's theirs, or more likely not theirs and not theirs, and then that's when things slip through the gap. So making sure there's that unified sort of ownership of policy. What our survey ultimately sort of showed, what there was 4 real sort of, I guess, distinct areas of interest for our members. And do you want to sort of say that, I guess they say policy falls into these 4 different buckets. So health policy, which includes workforce related matters and access to different services and provisions. So there were some specifics mentioned, like access to CAM services, dentistry, but also to some of the more specialist services, parent-infant relationship support and perinatal services. Another bucket was around health inequalities. So there was sort of a real commitment to tackle some of the variation in how they manifest in different parts of the country, but also that actually there are underlying factors that can create unequal outcomes that aren't just about access to health services. So things like poor housing is the example given there. And then a third bucket was around children's centres and universal services. I guess the sorts of things we would say now happen within family hubs. So parenting courses, inclusive services. So those being, for, the example there's for dads, but also the LGBT community, those who maybe don't have English as a first language or different cultural backgrounds. And within that, noting obviously the importance of workforce, and it's not just that we need necessarily more workforce, but also training to help them and support them. And then the last bucket being around a range of financial issues that were raised. So issues around maternity and paternity pay, um, universal paid parental leave, and what that could look like. A lot of contribution around fully funded childcare and what that might look like. One of the questions we asked was, should we address gaps in mental health commissioning for under twos? And again, a very overwhelming sort of response in support of doing that. So just to give you some background of why we asked that question. So we did some research, I think in 2019, 2020 sort of time, that found that in clinical commissioning groups, as we had then, less than half of commissioners had services that were providing services for under twos. And that's despite the long-term NHS plan saying that mental health provision should be provided from birth. And again, like I say, a large majority agreed. So what's helpful from that then is that it gives the steering group a look at a good steer, but then also then to look at obviously how that might work, given that the NHS has been reorganised in different ways since that initial research was done. So clinical commissioning groups not existing really anymore, and the integrated care systems having the responsibility for the commissioning over different geographies, different footprint, and in many cases different personnel involved in that. We also asked a question about should public spending be rebalanced so there's a greater investment in prevention. And again, we came back with a large, overwhelming supportive response. I just read out from our consensus statement because I think it's sort of helpful. So when any member, organisation, or individual signs up, again, they agree to the consensus statement, and that currently says governments should make clear concentrated, sustained enhancements to funding to make sure that babies and their families get the support they need. This includes funding across maternity, public health, children's services, and mental health services. And so, like I say, we asked members if they agreed that public spending should be rebalanced, so there is that greater investment in prevention. So there's overwhelmingly a yes, but as in many areas of this, there was a bit of a discussion and some more information around what actually rebalancing might look like. So we had this sort of framing question raised through the survey, which was incredibly helpful, which basically says, sadly, we need greater investment in prevention alongside investment in picking up the pieces and supporting where prevention hasn't helped. So while I've answered yes, I'm not sure rebalancing is the right approach if it implies taking funding away from other areas of work around the first 1,001 days. So we've called for investment in prevention and therefore not talked about rebalancing, because that implies taking money away from somebody to give it to someone else, rather than, and what I think we will largely agree is we need more money spent in the first 1,001 days so that there's not only to give babies the best start that they can and to have support for their family to help bring them up, but also to save costs and more expensive interventions later in the long term, because they'll be hopefully addressed and not let to slip in that sort of way. So again, across the survey, we got again largely four buckets of areas that people felt more funding was needed. So that first bucket being services, and again, the sort of whole range of services that you might expect. Not just, I think important to say, not just public sector provided services, but also those provided through the voluntary sector, which has a unique set of challenges facing it from the way it's funded, etc. So there was something on those services. There was another bucket around not just having universal services, but having them tailored and for more specific groups, and investment in scaling up some of those where they've been sparse. A third bucket around embedding relationship education and support. So public awareness campaigns, that type of thing, to help make that case and help it be better understood. I think the feeling was that a lot of it, there's great work happening, but maybe people don't fully appreciate why that's so important. And then a fourth bucket around financial support, I guess, mirroring what came back earlier on. How are we supporting pregnant mums? Do they have the resources they need to look after their basic needs and also the basic needs of the family? Support for families on low income. Again, sort of concern around sort of poverty and the impact that can have on a baby as they grow up and develop. What's interesting within the sort of funding discussion is the way that the political parties are talking about things at the moment. So the Conservatives are talking and using language of finding further efficiencies, which is I guess, a way of saying not just no more money, but having to cut something to possibly to fund elsewhere, whether that be staff reductions or varying provision. And Labour are saying that should they win the election, there will not be any additional money for public spending until the economy improves. So trying to stick to the current government's sort of spending plans until the economy gets into a better place. So whilst we're talking about the need for more funding, I think it's widely acknowledged within the sector that it's needed in a range of areas. We're in the context of the two main political parties being reluctant to promise a lot of extra funding. So yeah, that's it for my section. So what I'll do now is pass on to Laura Anderson from the NCB to talk through how we've taken some of that and developed it into our recommendations. Laura?
Great. Thank you so much, Ben. And as Ben just said, my name is Laura Anderson, and I work in policy and public affairs at the National Children's Bureau, who's worked quite closely on developing these recommendations and this campaign. Let's go next slide. Great. Yeah, first 1001 Days Steering Group is made up of 13 organizations and 4 expert individuals. And over the past 9 months, the focus of our work has been overseeing the development of the Manifesto for Babies. And in July last year, we reviewed the membership survey findings to drive forward these recommendations and potential changes through the general election. Next slide. So 6 of us volunteered to join a Manifesto working group with additional meetings and working sessions to look at the survey findings in more detail. These organizations were NSPCC, Institute for Health Visiting, National Children's Bureau, Anna Freud Center, Professor Eunice Lumsden, and Ben and Tamora from the Parent Infant Foundation. Ben and Tamora analyzed and advised on policy the parties were developing. So, for example, Labor's missions for opportunity, education, and health, and that was link up our recommendations to Labor's existing priorities to ensure maximal efficacy for the manifesto and for the campaign. So some of this kind of linking work was really looking at, what the party leader has said and what's kind of been published. So last year, Keir Starmer announced a series of missions that Labour would focus on if they win. There are opportunities in here for babies and toddlers, but what we saw was the opportunities can come in many different parts of this mission. So the education and health missions are siloed, where we want to continue to advocate for the needs of babies to be addressed across all missions, not just, one particular bullet point. They've recently published a child health plan, but this doesn't mention babies' emotional and social well-being, only talks about specific programs on things like that aren't really addressing root causes and not using early intervention approaches. So we, in doing all this scoping work, are really using that to drive forward the work that we're doing now, making sure that we're really getting of the kind of existing people leading these policy conversations. So for these emerging policies, sometimes the needs of babies are being siloed, and in other times babies aren't being mentioned. But in this way, we're, really connecting the pieces, using what they've kind of shown us already publicly to make sure that what we're doing really has the most impact. Great. Next slide. So doing this as well, really kind of maximizing impact. We've aligned to other coalitions and campaigns. The first work I'll kind of talk about through the National Children's Bureau. Several of us attended party conferences in September and October last year. And the NCB team with the Children's Coalition, I'll talk more a little bit about in a second, hosted some events at both Conservative and Labour Party conferences, engaging policymakers and parliamentarians. And we also had our Director of External Affairs, Phil Anderson, be on a panel at the Early Education and Childcare Coalition event. Phil highlighted key priorities ensuring babies get the highest quality early education, childcare, and support they deserve. And Phil's contributions really aligned with the collaborative work done with the 1001 Days and Parent Infant Foundation, including calling for greater investment in the first 1001 days and early intervention approaches. So in terms of other campaigns, National Children's Bureau, or NCB, convenes regular meetings of different coalitions and organizations throughout the children's sector, one such being the Cross-Sector Manifesto Influencing Group, where we recently organized Tamora to share the recent things that she's been working on here with this Manifesto for Babies. And one area of overlap that we saw was the recommendation calling for a cabinet minister. So what the Children's Charities Coalition did, kind of one part of this broader manifesto influencing group, was commission some analysis and some research from the Institute for Government, looking into this recommendation. So asking policymakers, what they thought about this recommendation and the feasibility of this, what they thought could actually be done, and if this is a good thing to kind of call for. And from this, they actually said that instead of calling for one person, it should be a kind of top level commitment with a cabinet committee. So, the work done with this campaign was then shifted based on that research, based on that work that was kind of drawn from that larger manifesto influencing group. Tamora, I'm not sure if you want to come in here and speak a little bit on that, or if I've kind of articulated well enough.
Oh, that's perfect, Laura. I mean, do keep going as you like. I'll come in a minute.
Amazing. Sounds good. So yeah, other things that we're doing with this kind of broader sector manifesto group is discussing how to approach eradicating poverty. And it's been agreed that we'll then echo the Child Poverty Action Group in calling for the 2-child limit to be lifted. And I will say there's further discussions happening right now to develop kind of more sector alignment on eradicating child poverty, of which 1001 Days is a part. So, that 1-2-child limit call has already kind of been solidified, but as we have more meetings, further conversations, and kind of pool expert knowledge from people that really think about poverty often, we're going to come up with more kind of concrete recommendations in the future and make sure that as a sector, we're kind of coming to the next government with very clear asks from them. One other kind of connecting or aligning campaign is that we included campaigns for the first 1001 Days member to help them in their work. So for example, the Fatherhood Institute's campaign for enhanced parent leave. Next slide. Just finally, I'll talk a little bit more about the Children at the Table campaign and how the 1001 Days movement and Parent Infant Foundation has impacted. So ahead of the upcoming general election, NCB has joined up with Action for Children, Bernardo's, the Children's Society, and NSPCC to make sure that babies, children, and young people are at the heart of the next general election. Our 3 calls include an ambitious cross-government strategy and outcomes framework to drive improvements, a new approach to decision-making that places children's needs, wishes, and outcomes at the heart, involving babies, children, and young people at every step of the way, and investing more of our national wealth in improving the lives of babies, children, young people, and spending strategically on early intervention and prevention. So as you can see, a lot of these calls absolutely align with what's happening in this group. And it's great to really see that the calls kind of, being echoed here and developed in this manifesto kind of are making it to other spaces and really feeding into other campaigns. So we've recently launched a report for this Children at the Table campaign and had a parliamentary event. And so all the calls are kind of, almost rippling into other campaigning work and hopefully reaching the ears of more parliamentarians and decision makers. I will now pass on to Tamora. Thanks.
Hello. And can I just say a huge thank you to Laura for stepping in at very short notice because she had a colleague who was unwell, but she's done an amazing job there. Also, just to let you know that if you'd like to put any questions to us, I've just got a few slides, but if you'd like to put any questions in at all as we go through, please do type those in and we'll leave at least 10 minutes to answer any questions you've got. Okay. Could I have the next slide, please, Ben? Thank you. So, what we found through this process is we gathered so many brilliant ideas, and we talked to so many great colleagues like NCB and the other charities that we gathered a huge range of policy recommendations because so many things impact babies and toddlers, of course. But we had to make sure that we weren't just presenting a very long list. So with the working group, we came up with 5 buckets, 5 headlines, which make the Manifesto for Babies document easier to navigate. So you can see the headline 5 here, and I'm just going to talk through what comes under each of these sections. And some of the titles there you'll see are probably quite familiar from my colleague's presentation. So first of all, we're calling for an ambitious cross-government strategy for babies. And it struck me actually that just this week, we had the Association of Directors of Children's Services calling for something very similar too. So again, we're seeing this as a real, there's a real desire for this ambitious cross-government strategy. In that bucket, we include some of the specifics like the recommendation for a cabinet committee. And of course, what we are going to reflect on there is that many years ago now, we had the Sure Start programme. We have the Start for Life programme now, which is great, but it's just getting going. And therefore, when we talk about both the need for an ambitious cross-government strategy and also investing in prevention, we need to point out how important this kind of national leadership for babies and young children really is. I'm sure many of you will be aware that Start for Life funding currently only runs until the 1st of April next year. And what that means is that this year, 2024, is really a crucial year for consolidating the programme's future. So we can't, of course, speculate who is going to be in government in a year's time. But if there's an election in the autumn, we have to make sure that there's some degree of continuity, commitment beyond next April, because of course, as we draw nearer to that time for the programme ending, there's a risk that the focus will go elsewhere. Maybe services will start being wound down, or they will stop taking referrals, staff may get redeployed, and really it's just getting going. So what we want to see is more investment into a national strategy, more ambition going behind this really important national initiative. So we're also calling under investing more in prevention. And in that section of the document, of course, we're talking about, the rationale for investing early, about the brilliant cost effectiveness that you get if you do invest earlier in the life course. But we're calling for a national target to reach 60,000 vulnerable babies over the next 5 years. That's really to address the problem that Ben talked about earlier, that there are services, but they're patchy. They're not the same everywhere. And whereas the NHS long-term plan has a target to reach tens of thousands, I think it's around 60,000 women with perinatal support, it doesn't have an equivalent number on the number of babies that will need support, even though Start for Life guidance does recognise that at least 10% of babies are at risk of disorganised attachment. So we're really keen to see a national target set, an equivalent target, and that could be introduced into the NHS long-term plan. Then the third bucket around tackling health inequalities, under this area, this is where we're talking about the importance of tackling some of those drivers about committing to tackling child poverty, scrapping the 2-child limit, as colleagues have mentioned already. And we're also, in view of the fact that we now have the integrated care systems and they have statutory duties, we want to make sure that those new commissioners are held accountable for their statutory duty to reduce health inequalities. And we're pointing out how effective it can be again here to really invest in services that support babies. So when we think about targeted, effective, proven services like the family nurse partnership, like midwifery, continuity of carer, we want to see those available to families in need everywhere, not just in some places. And we're also recommending using a shared outcomes framework. And there's a great example we've included that was developed by For Baby's Sake. In our fourth bucket, sorry, we're coming to workforce. Workforce is always a key consideration. How do we actually make this happen, given there's so many stresses and strains, so many issues with retention of key workforce groups? What we're saying there is really that we need a workforce plan for social care and the early years to complement the NHS workforce plan, because of course, you know, NHS workforce are absolutely key in the services for babies, but we also need those who are not directly employed by the NHS but are equally important. So we're calling on the next government to collaborate with professional bodies to look at these issues, to accurately estimate the need, to address workforce gaps, and to work on staff retention, so that we're not just calling for a certain number of people to be recruited because there's many staff leaving. We're also looking at, you know, how do we retain staff, and also how do we train staff in early years settings in infant mental health. We flag up too some of the issues, and this came through the members' survey, that the voluntary sector is managing an increasingly complex workload, higher needs, and the importance of commissioners making sure that the contracts make provision for training on infant mental health and adequate supervision time. And then the last recommendation here, the rapid review of tax and benefit system for parents and carers of the under 2s. This was really because we received like a really wide range of really interesting, really innovative ideas about payments that you can make to parents and carers to just enable them to really have time to be a parent or a carer. So I think we've discussed on a previous webinar that there is a lot of political interest in supporting parents who want to get back to work because policymakers recognise that childcare is unaffordable, often unavailable. So there's a lot of political interest in, you know, what that looks like, but there's also a challenge. Staff ratios have already changed. There's a question of how do you make sure that childcare is high quality as well? How do you look after babies' healthy development as part of that? So we are saying government in this review should recognise that supporting babies' development is just as important a policy objective as getting people back to work, which is very much the economic focus that is driving this. But we also, of course, support parents' choice to return to work, but they need quality childcare for that to be available. And within that last bucket, we're talking about the need for better paid parental and paternity leave to help fathers play a more active role. So there we go. That is the overview. And next slide, please, Ben. This is just the front cover. So I've just got the design back version this week. You'll see it looks very much like the red book that we have for child development. So we are echoing that in setting out the manifesto for babies. And we are asking candidates of all parties to read the manifesto, but just reflecting on the challenge that Ben talked about earlier. We know that there is a constrained economic environment and that neither party is committing to huge uplift in investment, unfortunately, to the degree that we saw, for example, under the Sure Start programme. That doesn't stop us calling for investment at all, but we are mindful that within our manifesto for babies, there are recommendations that might take years to find the money for. So whilst we will continue absolutely to press for all the political parties to consider all of the recommendations, we understand, we have a realistic view about the challenges of anybody signing up right now to absolutely everything that's in here. So our request is that they consider the proposals that are in here, and that they promise, if they are re-elected, they pledge to speak up for babies. So that's going to be the focus of our campaign. We have the manifesto to explain what that would look like in practice in government, and then the request is for candidates to speak up for babies if they are re-elected. Next slide, please. So the policy recommendations have been signed off by the steering group, and that was fantastic, and it's been such a privilege really working with all the experts in the steering group and learning about all of the work that the First 1001 Days movement has been driving here. So that's been all signed off, and therefore those recommendations have already been shared with key advisors working on the policy reviews that Labour have underway. And that's because, as I'm sure you've been following, they have been undertaking a review into what their policy should be on childcare. There is a current review going on into what the mental health strategy might look like under a Labour government, and indeed, of course, in parallel, because we're all charities and we all work cross-party, we're sharing these recommendations also with current government advisors and the ministerial team. So the formal public launch of the manifesto that you've seen the front cover of is due to take place in March. I am just confirming a date with Tim Lawton, who chairs the all-party group for conception to age 2, and that will be another virtual meeting, so you can join that and see it in its full glory. And that's the point at which also we'll just be explaining that we would like candidates from all across the political spectrum to speak up for babies. Now that theme, that campaign theme, is going to run through the year with further events happening at key points in the year, for example, during Infant Mental Health Awareness Week in June. And we're also developing a campaign video and some further materials like a toolkit to support MP visits and engagement with candidates as we go through the campaign and we go through the year. So that, in summary, is our Manifesto for Babies and Speak Up for Babies campaign. I'm just going to see if we have any questions, and also I'm going to put our email addresses into the chat just to make sure that you can pick up. I realise we've covered quite a lot there, so if there's anything that we'd like to pick up separately after the meeting, please do get in touch. So I have got a question which says, is there anything in the manifesto on nutrition and infant feeding in the first 1001 days, including measures to support breastfeeding and ensure infant formula is used safely and is affordable for all, really important for addressing poverty and health inequalities. First Steps Nutrition has some great info on this. Thank you very much for that question. So I think it's worth just reflecting back on the level of the manifesto. Those headlines are quite high level. So what we have done is we've signposted where there has been a link to related campaigns, but we haven't gone to the detail of talking about specific interventions like nutrition. So no, I'm afraid that's not mentioned as a specific. One of the challenges that we had really was in view of having so many submissions, and the challenge was knowing that politicians tend to read only a certain length of text. One of the challenges we had was trying to condense things down. So there is a lot in the manifesto about the importance of access to health visiting and parenting support. There's a lot on sort of health visiting services, but we haven't broken down into talking about all of the specifics of advice and different interventions. So, but I will happily sort of give you a bit more chapter and verse. We are, as I say, due to publish pretty soon. So hopefully you'll see what that looks like, and how issues like that ladder up to those headlines that we're talking about, like the importance of investing in prevention and making sure that sort of advice and support is available to parents. I'm not sure if, I think I had a, thank you. I think I had somebody coming in, but no, actually. Okay. Great, but I happily liaise offline, but I'm sure when you see it, you will understand what I mean about the level of the document. Ben, did you want to come in, or is that an old hand, I was going to say?
I didn't even realize I had a hand, but I just come in just to say, because we don't have the exact details for the All Party Parliamentary Group to launch the manifesto yet. We will be sharing that primarily through our newsletter and our social media channels. So if you don't receive our newsletter already, I'll shortly put the link to sign up into the chat, so that you can do that. And when we've put the video on YouTube, I'll make sure it's in the description under the video. So make sure that you can sign up so you don't miss out, because that will be I think quite a good occasion for us as a movement.
And actually, while I just wait to see if anybody else has got a question, it also strikes me, Ben, that we are very conscious that since we've planned the launch time frame, and actually the launch is very much to try to publish the document before the local and London elections, which are on the 2nd of May. So Parliament will break up on the 26th of March, and then we have the election period, during which, understandably, a lot of the politicians are focused on local campaigning. What we were keen to do was to at least publish the document before that period and before Easter. So that's sort of dictating the time frame. But what strikes me is that obviously, since we've agreed that time frame, there is also, as many of you might know on the call, going to be a public awareness campaign run by Start for Life also during March. So it will mean that besides the work we're doing, there should be quite a lot of attention and noise around the public awareness campaign being run by the Department of Health and Social Care. And there's more information about that, and indeed a sort of sign up function where you can find out more, that DHSC are hosting. So I think it will be a very timely period for talking about babies' development in March. And then once Parliament returns after the election in early May, we will start looking ahead to getting those visits in to Infant Mental Health Awareness Week in June, and we'll have a second push of the campaign. And then the difficult thing is mapping out exactly what's going to happen in September after the August holiday, because we might be coming back to another party conference season, in which case, again, the first 1001 Days movement, the team, Ben, me, Keith, we've attended those, and we will be working with NCBs and others to meet people there. But it's always possible that an election is called at the start of September, and then there's no conferences. And in that case, we will be focusing on engaging candidates through media and social media. I have got, whilst I've been babbling on, I've got a couple more questions in. So thank you very much. So I have a question from Beth around how do you become a member of the first 1001 Days movement? And I know Ben will follow up with you immediately following the webinar. An organisation obviously needs to sign up to the terms of reference and our aims, so we can follow up with you further to that. So that's lovely to have your expression of interest there. Thank you. I then have a question, a very important question about the target group of MPs you want to engage with, which is absolutely right. We have to be targeted. So I mentioned earlier that as a charity, and all of you who are charities, of course, we all know we need to work cross-party because we are not able to support one party over another, and it's not appropriate. But targeting is really important. The invitation to pledge to speak up for babies will be open to all candidates from all parties across the UK. Actually, it's worth noting that a lot of the manifesto is more England because some of these areas are devolved. So, for example, the Start for Life policy, of course, just applies to England. However, we have some really important work happening, of course, in Wales, in Scotland, and there are complementary and equally important policy asks there. So it's an open invite to all candidates standing in the UK general election to take the pledge. But as a campaign team, yes, we do have an eye on MPs who have either got a relevant role. So, for example, shadow spokespeople for education, for health, for work and pensions. So we have been writing already to them, seeking to get them to visit local services, for example. And we've had one visit already, and we have another one hopefully coming up on International Women's Day. So yes, we are keen to see those MPs from across the parties who either have a relevant role or who have a really strong interest in babies and young children, because of course parliamentarians are being targeted by a number of different campaigns. We think ours is the most worthy, the most important, but we're also realistic, and we know that really it's those with a really personal strong interest or connection that are likely to really get involved in championing babies in the next parliament, which is what we want. When we come back after Easter, we are going to make a toolkit available on the campaign site that will support visits, support approaches to local parliamentary candidates. And we would really encourage, if you haven't had your local MP visit before, we would really encourage you to work with us to get them to come and visit. We can invite them to visit during Infant Mental Health Awareness Week, or in practice around that. So May, June, July, all of that time frame is absolutely fine. We have a really good, effective approach to make that happen. Essentially, an MP likes to visit a site within their own constituency. They like to meet families and babies, and we know that that's what really compels and motivates them to really follow through and work for babies. So yes, we have when you contact us, we obviously know where some of the parent infant teams are, we know where some of the other services are, and we've looked at who the MPs are. But equally, if you feel like you could host a visit, then please do get in touch. We'll also be providing sort of template letters so that you can write to candidates, ask them to make a pledge, even if you can't host a visit, which is obviously a bit more work intensive, but it really is worth it, isn't it, Ben?
It is, yeah. It really helps to make that sort of emotional case. Quite often we're sending through briefing documents and that sort of thing. We're giving them the information, but having MPs engage in a visit in that sort of way helps make that emotional connection with them, and I think that's how you win that, not just their minds but their heart in the long term to the cause, and help them feel that it's a bit more of a priority than either maybe they thought or you sort of raise it up in competition with some of the other things that they'll be lobbied on. I just want to address the question about joining. I've answered it in writing in the Q&A function, but just for anybody else, if you want to become a member of the First 1001 Days movement, either as an organization or as an individual, it's fairly straightforward. There's a form that you'd need to complete. If you're an organization, you'd need to send us a logo and you'd need to confirm that you agree to the consensus statement. There's no cost involved, but the benefit is obviously you get to be part of the movement, be able to get involved more directly in our work as well. So if anyone's interested, you can email me on ben@parentinfantfoundation.org.uk.
Great. And the all-party group meeting, just a word of warning, they tend to take place in a very pokey small room. So we tend to only be able to fit speakers into the room, plus of course the MPs. So but they do get streamed, so it's good for joining remotely. Right, well, if there's no more questions, and again, I invite you to of course contact us separately if anything else occurs, or if you want a bit more clarification, or if you have any ideas or would like us to support with contacting any particular MPs. I had a great conversation just this morning that's about, really interesting service where they're quite keen to have a visit. So please don't hesitate to get in touch. We're really excited about speaking up for babies, getting every political candidate to speak up for babies, regardless of where in the country they're representing. And we really hope you will be able to join us at whatever level you're able to do. If it's a visit, fantastic. But if it's sharing stuff on social media, if it's writing to your local candidates, all of that is hugely valuable. Thank you very much for your support. And I see we've got a couple of people that are saying they're going to contact, which is lovely. So we will come back to you. Thank you very much. Assuming no final questions, I am going to thank Laura again for stepping in at late notice. Thanks very much, Ben, as well. And thank you for driving the slides for us. And thank you all for taking the time out to join our lunchtime webinar series, and hope that you'll like the manifesto for babies when you see it very soon.